The president said,
"We have tested almost 40 million people. By so doing, we show cases, 99% of which are totally harmless."
That's not true. We're approaching 3 million cases in the United States. There have been about 130,000 fatalities here in the United States. The hospitalization rate alone is close to 20% cumulatively over the 6 months or so of the pandemic. And then of the people who are hospitalized because they need help with breathing or other aspects of this disease, a percentage of those end up in the ICU, and most of those people end up on ventilators. No one has really good data on how many Americans have been put on ventilators. Certainly thousands and thousands have. When they're using a ventilator, they will put a plastic tube down your throat into your windpipe, and then they adjust the pressure and the amount of oxygen that's going in, and they're essentially breathing for you. Around 35% die, maybe 40, depending on which study you look at, and about 60% survive. Coronavirus often, but not always, presents first with fever and a dry cough. It is primarily a respiratory disease, so a lot of people will experience shortness of breath, especially those who are going to get the more severe form of COVID-19, which is the disease caused by the virus. But it attacks a lot of different parts of the body. People have experienced kidney disease. People have experienced heart problems. There are blood clots that have gone to people's brain and caused strokes. There are gastrointestinal problems, difficulties. A lot of people present with diarrhea, but still primarily a respiratory disease. The people at greatest risk in COVID-19 in this pandemic are people suffering from pre-existing conditions. The most dangerous of these is pre-existing heart disease and diabetes. Both of those groups tend to do far worse in the hospital or when they contract the disease than other people. The WHO, the CDC, doctors around the world, all kinds of other medical groups have spoken volumes about the harms caused by this disease. It is a terrible disease. Yes, there are some people completely asymptomatic. That is, they will go through the entire course of their disease without experiencing any symptoms whatsoever. There are quite a few who will never even know that they had the disease unless they were tested. But I have interviewed numerous people with this disease, and to call it harmless, except in 1% of the cases, is just not supported by the science. It's not supported by the clinicians who have seen the patients suffering from very deleterious symptoms for 60, 80, 100 days. It's just not supported by the facts.